Here's how to do assessment for the provisional crown. First criterion says that the junction of the restoration and the tooth must not be detectable by the probe. So you bring the sickle probe or any other probe and run it vertically from the tooth restoration, the tooth to the restoration, like this. In case there is any catch that you might feel the probe, it means you have a roughness that requires smoothing. All around, you do the same thing all around the restoration from lingual or palatal, and also try to reach the proximal. In case you find any roughness, it means you're gonna have to remove it by running the burr manually over the area or the junction between the tooth while the crown is attached to the tooth. Number 2, overhangs. How to check for overhangs? You must check the overhangs by using the dental floss. If you pass the dental floss, there shouldn't be any catch and the floss goes out without being shredded. If the floss got shredded, it means there's a overhang or a roughness that requires smoothness with the polished strips. Number 3, excess material. It is preferable that after you cure the flowable or the provisional crown material is that you look for any uncured or cured excess flowable or provisional underneath the gums of the preparation or the next door teeth or the gums. Number 4, damage to adjacent or assessment tooth. Usually this happens during the preparation of the PFM. So you see, if you have damaged the adjacent during the preparation, you're going to lose points from both your PFM and your provisional because that particular criterion is present in both tasks. So make sure, even if you have a minor injury or a damage, you correct it by smoothing it with the Soflex discs. Number 5, damage to the gums. Always make sure you have no damage to the gums during preparation and during provisional crown finishing. Restoration polish. It is preferable that your restoration is having a polished to smooth surface, no roughness, no bubbles, no excess, and have a continuous shine, no irregularities blocking the translucency. Restoration margin finish. Restoration margin finish, it's better be checked. This is you naturally get the finish of the restoration margin right if your finish line of the preparation was smooth finish line, giving a nice and smooth margin of the provisional. If your finish line provisional was not smooth and continuous, it means that subsequently your finish line of the provisional will become rough as well. Unfortunately, this mistake cannot be compensated for in the provisional because whatever the mistakes that you had in your PFM will duplicate in the provisional. Material handling or porosities. There shouldn't be any porosities, neither on the outer surface nor the inner surface. However, if you catch any porosity, you should remove it by correcting it with flowable. Material handling, curing. There shouldn't be any uncured flowable. Sometimes if you prematurely remove the crown after adding some flowable to it, might result in some parts of uncured flowable, or maybe some hanging on the gingiva or the adjacent. Make sure you remove that by curing it and then scraping it off. Restoration integrity. The restoration should be present and intact. Make sure your provisional crown has adequate retention so that when you attach it to the preparation, it will not become loose and fall in the mouth. So retention means having the restoration in place so that when the examiner is marking you, he will find it attached to the tooth rather than being lost in the mannequin mouth. Emergence profile. Emergence profile basically means having the neck of the provisional converging. This means that no overhangs, because if the emergence profile were poor, giving the neck of the tooth a triangular or straight line blocking the embrasure, the triangular embrasure, it means you have overhang and you have poor emergence profile. So what do you do if you have a poor emergence profile? It means that you are going to have overhang and lose both criterions. So what you should do, you should remove the excess to give it the nice convergence, like narrower on the neck and wider towards the contact. This step is mandatory if you want to have a nice emergence profile and have a continuous transition from the area underneath the gums till the contact area or point. Proximal contact tightness. How do you check for the tightness? Visually you can see it, and also the contact tightness is also checked using the dental floss. So if the floss passes with a minor resistance creating a tick sound, it means you have the right contact tightness. Otherwise, if the floss were struggling to get in through the contact, it means you have a wide contact and a tight contact. Alternatively, if the floss were passing passively and without any resistance, it means you have a light and poor contact, so you should increase it by adding flowable to it. The proximal contact contour. The contour means where is your contact area or point is located. Ideally for central incisors, it's in the junction of the incisal and middle thirds, so it is more incisally located than in posterior teeth. The contour shouldn't be like a point, the pin like a point. It should create something like an area. So the contour means the size of your contact. It shouldn't be too shallow, neither too wide. The morphologic tooth contours. Optimal restoration of morphologic tooth contours. Obviously, your provisional should duplicate the original tooth prior to preparation. This includes the height of your incisal edge or cusps and the mesial and distal incisal line angles, the axial line angles from labial and from palatal should be rounded and natural, curving, not straight, giving a square shape. Lastly, the occlusal contacts using adjacent and contralateral tooth for reference. Occlusal contact, there has to be optimal occlusing contact. So you see, we just talked about the contour of the contact, I mean the size of the contact, and the tightness of the contact is also, it should be in the optimal range. Note that restoration that is in infraocclusion or supraocclusion by less than 0.5 millimeters is considered a borderline. It's considered satisfactory. What do we mean by that? We mean that checking the height of your restoration in terms of the height of the full restoration and the height of the contact, it should be referenced and equal to the adjacent and to the contralateral tooth. Any poor height, like when relating the marginal ridges of posterior teeth, like if your provisional is higher than the adjacent, it means you have a poor occlusal contact. We don't say proximal contact, we mean the occlusal contact. Please note that in the last criterion, we're talking about the occlusal contact, which means the relation with the adjacent in terms of height. This criterion mostly applies to the posterior provisional crowns because usually when you have a marginal ridge, it's just like in amalgam or composite restoration, the marginal ridge has to be in the same height, otherwise you have a traumatic occlusion and a margin that is likely to get and a marginal ridge that is likely to get broken and or causing trauma from occlusion. Thank you.